Just wanted to ask you how the course has gone and how you felt it's gone. This course is unique, it's the first time we've run it, but it's got a remote aspect where you give your machine for the duration of the course. How did you find that? Did it work? Was it useful?
I thought it was great actually. So having the machine in the privacy of my home meant I could scan myself and my children and my cat in relative privacy, kind of hone my skills so they're a point at which they're acceptable. It was amazing actually. It was really exciting to find my gallbladder for the first time.
Couldn't find a heart though.
There is none. My heart
No.
is enclosed in stone.
No, I thought it was brilliant. I like the fact that we've got the machines ourselves so we could play around and use them and try them, get things wrong, practice on it, get things right, terrorise our family, pets, friends, that was all colleagues. So that was good. It also means we come to the study day now with a lot more skills, a lot more hand-eye coordination skills and a rough idea of what we're looking at. I think it's something that we probably lag behind Europe in many ways, and I think it will be the norm that most frontline clinical practitioners will use scanning as part of their thing. For us, it provides another level of assurance, especially with the surgical services and things we do, that we can actually provide a really comprehensive follow-up service for our patients.
So going away after today, do you think you will use the ultrasound in general practice? And do you think it will change the way you work?
So I would love to, absolutely love to. I think I've already used it a couple of times and it's been really helpful. I would hope it will change the way I work. My only concern is the way funding is at the moment and the restrictions we have on primary care. For me, upskilling and stopping hospital admissions and A&E attendances, I don't get any benefit from that. Neither does my practice. And I think it needs that bigger picture change, Wes Streeting, if you're listening. Of
course he is.
Let us do more. Let us do more. Because we can do it. We are capable and able to do it. We have people in our area who use ultrasound scans to make sure they put filler in the right place, and I can use it to distinguish between whether somebody's gallbladder is inflamed and they need to go in, they have a pneumonia. So allow us to do this.
Or end of life, as we were saying.
End of life, yes. So sometimes, doing that scan may help you make a decision that actually there is nothing further we can do for this patient. Instead of rushing them to hospital, we can have a discussion with the family and make sure things are comfortable and they're right for them, so they have a good end of life.
No, I completely agree. I think there's huge potential. I can see us using the ultrasound scan more and more and more. I think there is a real importance now on trying to maximise the value and the benefit that the NHS can get. I think GPs, primary care clinicians are in a unique position to be able to supply a lot of those services. We just need resources, finance, money to actually be able to do the job that we really want to do for our patients. And I think there are real savings to be made, and I think it actually brings the care much closer to the patient, which has to be a good thing in this day and age.
Thank you very much for your time. Back to more scanning.
Thank you.
And a fun afternoon.
A fun afternoon, yes.
Well, point of care ultrasound scanning for lungs, number one, it is quite an easy skill to learn. And it's something that, in my view, is something that will make the difference quite quickly. GPs will be able to utilise it and see the difference it makes to patient care quite quickly. It takes guesswork out of using a stethoscope, basically. You replace your stethoscope with a modern technology, and so it has a lot of benefits, and there is increased satisfaction for patients and for doctors.
Hello, I'm Dr. Lee Purslow. I'm a GP based in the North East, and I enjoy using point of care ultrasound in primary care. Is it the Vscan Air? with a curvilinear and a linear side, which I see the handheld devices as the future of primary care diagnostics. Every day, one of these devices would sit on my desk, and if a patient comes in, the lad, I feel I can get an answer within 5 minutes. So an NHS ELT consultation, I'll pick up my probe and answer it with the probe here. Now, there's many reasons why you would want to pick up the probe and scan. One is the patients find it incredibly reassuring if you can do the scan and show them on the screen that this is very reassuring, this is normal, you compare it to the other side, you show them normal and send them off with some reassurance. And you can massively, dramatically improve your diagnostics. It takes some clinical questions which you're uncertain about, for example, cholecystitis, whether there's a gallstone there or a knee effusion, pulmonary edema or pneumonia. You can put the probe on and make it unequivocal. You can answer that clinical question very quickly. And because you can answer that clinical question quickly, the patient is quicker to a diagnosis, and they also, don't have to be referred maybe into hospital, so you can save an admission. And some of these low-level scans that go through radiology, can be avoided. I know there's a massive scans that go to radiology that really, shouldn't have been there in the first place. We can answer these with a handheld ultrasound. And I know that GPs really love picking up the probe and scanning. It's a nice, radical, unique skill, new to general practice, which excites the GP, and they can enjoy doing it and enjoy making diagnoses and getting hands-on and more tactile with the patients, which has been solely lacking as we become more and more looking after the complex multimorbid. It really does get us twitching our patients again in more contact. So if you want to learn to use ultrasound in primary care and improve your diagnostic capabilities, and for all those other reasons I've just mentioned, it's very important that you do some appropriate training and get appropriately skilled to use your ultrasound. If we have a responsibility to appraise this technology for our patients safely and effectively. And if you want to learn how to use ultrasound, then please do connect with us. Then we would be more than happy to discuss that with you further, and share an ultrasound learning journey with you. Thank you very much.